Ever get that like weird feeling, when you're just trying to do something simple, like reaching for your coffee and your hand, it just like shakes a little?
Yeah, I know exactly what you mean. Kind of unnerving, right?
Totally. And that right there, that shaky feeling, is kind of the jumping off point for what we're digging into today. Essential tremor, or ET.
And you wouldn't believe how many people are dealing with this. It's way more common than you think, like almost 10 million people just in the U.S.
Wow, 10 million, that's a huge number.
It is. And the thing is, a lot of times it gets confused with other stuff. It's not always easy to diagnose.
Right, so for this deep dive, we really want to unpack essential tremor, figure out what it actually is, how it messes with your body, and most importantly, what people can do about it.
Sounds like a plan.
We've got this really informative article from tremor.today. That's going to be our main guide. So first things first, what exactly are we talking about when we say essential tremor?
Okay, so essentially it's a neurological thing, right?
Yeah.
It's all about this involuntary shaking, this rhythmic kind of thing.
Okay, so it's not just like random twitches.
No, not really. It's more like consistent rhythmic shaking. And the tricky part is it can show up in different places, and the intensity, how bad it is, can be totally different from person to person.
So it's not always just the hands shaking. I feel like that's what most people think of when they hear tremor.
You're right. Hand tremors are definitely the most common. Like 90% of people with ET have that. But it can also hit your head, your voice, even your legs sometimes, though that's less common.
Huh. So it can be a whole body thing?
It can be, yeah. And there are different types too, like kinetic and postural tremors.
Okay, break those down for me.
So kinetic tremors, think of it as action tremors. Like when you're trying to do something specific, like, I don't know, write your name and your hands start shaking.
Oh, okay, so it's triggered by movement.
Exactly. And then postural tremors, those happen when you're holding a position. Like if you hold your arms straight out and they start trembling, that's postural.
Gotcha. So one's about doing, the other's about holding still. Now, the article also mentions this frequency thing, like 4 to 12 hertz. What's that all about?
So hertz is basically cycles per second. So a 4 hertz tremor would be like 4 shakes per second. A slower tremor, a 12 hertz tremor would be way faster, almost like a flutter.
So it's about how fast the shaking is. Makes sense.
And that can sometimes help doctors figure out if it's ET or something else.
Okay, that makes sense. And it's not just the shaking itself, right? There's also the impact on balance and walking.
Yeah, absolutely. Research shows that like almost half the people with ET have trouble with something called tandem gait.
Tandem gait, that sounds fancy. What is that?
Imagine you're walking on a tightrope, heel to toe. That's tandem gait.
Mm.
It can be tricky for people with ET, shows how it affects their coordination.
Okay, so it's not just a cosmetic thing. It can really affect how you move.
Yeah, definitely.
Now, the tough question. The article says there's no cure for ET. That must be scary for a lot of people.
It's true, there's no magic bullet. But the good news is the symptoms can be managed. Like, a lot of times, lifestyle changes and treatment can make a big difference. And if it's mild, you might not even need treatment.
Okay, so it's not necessarily a downward spiral for everyone.
Not at all.
So what kind of management options are out there? The article talks about medication and surgery.
Yeah, those are the big ones. Medication-wise, you've got beta blockers and anti-seizure drugs. And then if those don't work, there's surgery.
Okay, let's break it down, starting with the hand tremors, since those are the most common.
Sure. For hand tremors, the first line of defense is usually medication. Propranolol, a beta blocker, is pretty effective. Improves symptoms in like 50 to 60% of people.
Wow, that's pretty good.
Yeah. And then there's primidone, an anti-seizure med. Works about as well as propranolol.
So meds can be a real game changer for a lot of folks.
Absolutely.
But what if meds aren't enough? The article mentioned assistive devices.
Yeah, so those are like tools to help you do everyday stuff. Like simple wrist weights can help with mild tremors, provide a bit more stability.
Makes sense.
And there's also like high-tech gadgets specifically designed to counteract shaking. But those might not be enough for really severe tremors.
Okay, so it depends on how bad it is. And then there's the surgical option, deep brain stimulation, DBS. Sounds intense.
It is a pretty big deal, but it can be really effective for those who haven't responded well to other treatments. Basically, they implant these electrodes in your brain in a specific spot called the thalamus.
In your brain. Wow.
Yeah, and these electrodes are connected to a device like a pacemaker implanted into the skin of your chest.
So how does that actually stop the shaking?
Well, the device sends out electrical impulses to the thalamus. The idea is Those impulses regulate the brain activity that's causing the tremors.
Interesting. So it's like rewiring the brain a little.
In a way, yeah. And it's often done on just one side of the brain, but it improves tremors on the opposite side of the body.
Huh, that's wild.
There was a study that showed like an 83% reduction in tremors in the arm opposite the side where they did the DBS.
That's a huge improvement.
It is.
Okay, so DBS is a potential solution for severe hand tremors. What about head tremors? The article describes those as no-no and yes-yes movements.
Right. For head tremors, the go-to meds are usually the same as for hand tremors, propranolol, and primidone. But there's a catch. They don't work as well for head tremors.
Yeah.
Like 30 to 50% of people might not get much relief.
Oh, so it's trickier to treat head tremor.
It can be, yeah.
Yeah.
In those cases, they might try other meds like topiramate or gabapentin.
Okay, so more options, but maybe not as effective.
Right.
What else can be done for head tremors?
Well, they could try Botox.
Botox, like
Yeah.
the wrinkle treatment?
Yeah, same stuff. It's a neurotoxin that basically paralyzes muscles temporarily.
Okay, I'm following.
So for head tremors, they inject it into the neck muscles to reduce the shaking.
Huh. So it's like calming down those specific muscles.
Exactly. And it can be pretty effective for head and voice tremors, but not so much for hand tremors because it can make your hands weak.
Makes sense.
The thing is, Botox is temporary. It wears off after a few months, so you got to keep getting injections.
Okay, so it's not a one-and-done solution.
Not really.
And what about surgery for head tremors? Is DBS an option there too?
It can be, but it's more complicated. Head and voice tremors are often tougher to control, so they might need to operate on both sides of the brain.
Oh, wow, that's a lot.
Yeah. And the research on DBS and another surgery, thalamotomy, for head and voice tremors, it's kind of mixed. So it's not always clear if it'll work.
Okay, so it's a bit of a gamble.
Yeah, you could say that.
Now, let's talk about voice tremors. That one seems particularly tough, especially if you rely on your voice for work or just, talking to people.
Absolutely. It affects your larynx, your voice box. So your pitch and volume can go all over the place. It makes your voice sound shaky, unstable.
Oh, I can only imagine how frustrating that would be.
It is. But there are some things they can try.
Like what?
Well, Botox is often the go-to for voice tremors. Inject it right into the larynx muscles, help steady the voice.
So Botox, it's like a multi-purpose tremor treatment.
Seems that way.
Anything else?
They can try those same meds, propranolol and primidone. But again, how well they work can vary. And speech therapy can actually help too.
Speech therapy? How so?
They focus on breathing exercises, relaxation techniques, that kind of thing. Helps reduce tension in your head and neck, which can make the tremor worse.
Okay, so it's like a holistic approach.
Yeah, I guess you could say that.
Now, how do people even know they have ET? The article said getting a diagnosis isn't easy.
It's true. There's no one test that can say for sure, yep, you've got ET.
So how do they figure it out?
Well, doctors look at a lot of things. They'll watch you do stuff, like draw a spiral or hold a cup to see how the tremor looks. It's different from the tremor in Parkinson's disease, for example.
Okay, so it's about observation.
Yeah, and they'll look at your medical history, what meds you're taking, because some meds can cause tremors as a side effect.
Oh, that makes sense.
And here's the kicker. Sometimes a little alcohol can actually make the tremors better for a bit.
Really?
Yeah, but obviously that's not a solution.
Definitely not.
The big thing is, if you think you might have ET, see a doctor. Get a second opinion if you need to.
Couldn't agree more. So while you're waiting for a diagnosis or even alongside treatment, are there things people can do themselves to manage the tremors?
Definitely. The article has some good tips. Cutting back on caffeine's a big one. It can make tremors worse.
Makes sense. I feel jittery enough on caffeine as it is.
Right. And stress can be a big trigger too. So relaxation techniques like yoga or meditation, those can be helpful.
Okay, so it's about managing your overall well-being too.
Exactly. And as we mentioned before, small amounts of alcohol might help temporarily, but don't overdo it. It can actually backfire and make the tremors worse in the long run.
Right. Moderation is key.
Definitely. And no smoking. That goes without saying.
Of course.
It's also smart to chat with your pharmacist about any meds you're taking. They can tell you if any of them might be causing tremors.
Good advice. So as we wrap up this deep dive, what are the key takeaways for our listeners about essential tremor?
Well, it's a pretty common neurological thing. Shaking, usually in the hands, but can be other places too. No cure yet, but there are treatments, meds, assistive devices, Botox, even surgery. The best approach really depends on the person, how bad their tremors are, and how they respond to treatment.
And if you're experiencing tremors, the most important thing is to see a doctor. Get a proper diagnosis and figure out a plan.
Couldn't agree more.
Well, that was a fascinating look at essential tremor. It really makes you think, you know? It's so common, and yet a lot of people might not even know they have it. It makes you wonder how many people are out there struggling with this, thinking it's something else. Early diagnosis could make such a difference.
It really could.
Definitely something to ponder.
Yeah, for sure.